December. And for folks that have not been involved in projects driven by Colleaga, it could be very confusing because this is non-classical projects. So although there is a defined start date and a start to the project, we have an ambition to resolve a challenge. And in this case, as Dan aptly put it, the challenge was to impact people's lives in South Africa. And as we started off orientating ourselves by illustration on this slide, we grew the conversation, identifying initially the need to focus on PTSD in first responders and veterans. That gradually and very fast grew into a wider segment of folks inflicted by mental health challenges. And as the conversation grew, we discovered a lot more in terms of refining our understanding about the problem case. And along came Casey Chambers and Zane Wilson from SADC, South Africa Anxiety Depression Group. And that really refined our understanding about what really is happening here in South Africa in addressing those challenges. And really where we are at this point in time is driving through co-creating a value statement and a business case as we move forward to telling a story in our business case and pitching that for investors that could potentially fund this operation in South Africa. We were very glad about Osama Al-Hussein, all the way from Dubai, of the Department of Dubai Health Authority, both regulator and a provider of health services in that region, whom also showed an interest, and the collaboration is extended to that part of the world as well. So as we drive forward with initiatives in South Africa, our ambition is also to collaborate in other parts of the world with what we are doing and learning in this part of the in the globe. So really, as I mentioned, in December 10th, we kicked off. We introduced the concept to a number of key stakeholders and participants. And Katie, you would remember, we originally started off with 8 folks responding from 8 different companies. And we were really astounded that we had well over 30 companies participating in that first kickoff. Which really showed the extent of interest in what we're doing. And from that early session, we developed a shared purpose, and that was to impact the lives of South Africans afflicted by mental health care challenges. But also what came out from that was also remote patient care was also of interest. And in addition to that, another field for us was to not only focus on the patient, as you will see later on as we talk about the segments of the patients that we've defined, but also the family circle of care. That was important. So, and I think during later calls with Osama from Dubai, that became prevalent for them as well, that the practitioners in their part of the world focused not only on the patients, but also the family circle of care, and more so the parents of those patients. So from that early session, we defined started developing our project groups and agreed on a flight plan for milestones heading into 2021. Although I just have the 3 dates here, as Dan also mentioned, many other sessions, almost on a weekly basis, happened between the core group here in South Africa and the Sherpas guiding us through collaborative thinking, design thinking, and building our use cases and assumptions. And maybe, ironically, because we were, most of us that participated from South Africa being technologists, we focused primarily in the beginning on technology, and rapidly as the conversation evolved, we realized that the essence was about forming the use cases. So we've refined our ventures. It started out with 1, grew to 6, and we've, in the classical design thinking principle, that all got turned on its head. And where we have a use case assumption around the corporates, whom then will pre-select based on their particular needs in the field, what segments they are after. We've developed the early stage reference architecture that I'm not going to spend too much time on today, but we'll spend more time in the assumptions that we're making around the use cases and the business cases. And I think essentially for us now, as we move into the April period and developing our business case, is we want to test these assumptions that we've made with this audience. And as Katie has also mentioned earlier on, we have posted all of this information on the Colleaga platform, and you are invited to, if not during this session, to afterwards go and place your comments on the Colleaga platform and test our assumptions, what we're making. So onto the next slide. The studio really here in South Africa has set out to build a venture based on one of the commonalities that we found across all the segments that we identified, ranging from students through to corporate retail customers. The generic attribute that came out was the need to build a digital enablement platform. And this has also evolved. So we have an in-state digital platform that is state-of-the-art thinking and really covers a whole range of functional, architectural, technology architectural and business architectural attributes, and would be able to address to a greater extent all of this, or lesser extent individual components of this. So ranging from virtual mental health care, step care support model. So the step care model really was, Casey, I think in your experience in SADC, which appealed to us in building into our venture studio, that we've not increased the scope of our efforts into the professional clinician space, but really to act as a first port of call and triage to the point where we can have referrals back to the professionals. And your statistics that your organization is doing is, and especially that the increase of the calls that you receive on a monthly basis during COVID really illustrates and confirms to us that we're on the right path. Chronic disease management, we also spoke of, other than just mental health care, and especially focused on cancer, HIV, would also be an area that we would be interested in covering. From a technology perspective, multi-channel engagement platforms, so not just telephony, but also push and pull of technologies, and making sure that patients can reach the digital platform either through phone calls, through WhatsApp messaging, but also be served with information on self-help services and group collective support to define groups in the segments that we've identified. Because of the data security element in South Africa, especially the PAPIA Act and many other standards required for individual patient records, but also privacy, it is essential for us from the onset that we have built in a secure digital health enabling platform architecture, and that the further assumption that we're making of this digital platform is that it would be a collaborative impact innovation as a service, so cloud-based, and then later on, as we evolve the business model, hybrid cloud with brick and mortar front ends. And Casey, we can talk about the use case that you are busy building with containers in some of the rural areas or the townships in South Africa to reach those vulnerable patients. So essentially what we've defined, and this group has expanded and contracted, are students. We're making this assumption based on the research that Professor Jason Bankies from Stellenbosch University and his peers have just recently completed amongst 26 universities in South Africa, with a student population, a group participating in this research of over 1 million students, that clearly students with underlying mental health conditions is a segment that corporates might be interested in. And that assumption is based not on, again, classical project funding or technology project funding, but our base assumption, as you'll see later on when I cover the business case assumptions, is that corporates would feel the need for either providing funding for initiatives like this, reaching that target audience, from their marketing budgets or from their social responsibility budgets. I think, Osama, during the conversation that we had with one of your specialists in the primary healthcare sector out in Dubai resonated with us, with struggling parents, and these are not necessarily parents struggling with financial conditions, but parents in general that are in today's world of remote and distributed working, don't have the wherewithal to understand what it is to deal with youngsters at home, struggling with parenthood, the questions around that, but also potentially if they have an affected child in their household, how do they go about dealing with those issues? And that really came back to resonated with the focus that we wanted to drive through here in South Africa around the circle of care around the patient. I spoke about the other group about patients with chronic disease and their families again. And corporate employers was another segment, again, when we tested that with groups across the globe. We all live and work, and as Dan also mentioned, we zoomed out, we teamed out, we Skyped out, and the prevalence of increased mental health care conditions with corporate employers at home is an area that we believe is also potentially a segment that the corporate customers would want to target with mental health care support services. And then in our collaborative, as we expanded our conversation with our network here in South Africa, an interest was expressed with some of our facilitators in doing introductions in especially the telecommunications space and the large banking sector, to extend this service as a branding opportunity really to their front-end customers. So if you think about a Vodacom or which is part of the Vodafone operations out of Europe, and MTN, which is another big telecommunication provider, they sit collectively probably here in South Africa and Southern Africa with a population group of retail customers in the order of probably 45 to 55 million customers who are all connected, and would be an excellent opportunity for corporate customers to provide a discrete service to those customers. Again, in the retail customer space, another assumptions we're making is that some of these retail customers have possibly not received the type of support from the organizations that support them. One of the recent cases in the banking fraternity in South Africa, a big retail bank, in Q4 last year has lost 200,000 retail customers. And that is assumption for us is to approach that organization and provide this customer retention strategy to disgruntled retail customers by providing a branded opportunity like this in supporting those customers with something a lot more personal.
Into a discussion about the business case and the idea of going to corporates to fund it and what we want to find out there.
Yes, absolutely, Dan. As we evolved our conversation, and Jay, to your point, the more we reach out and broaden our conversation to a wider audience of especially the SADCs, the cases of the world that are practitioners, that know what is statistically and practically the prevalence of healthcare conditions in the different stages of severity, the more we understand, and it's we've had a couple of goosebump moments, Dan and I, that has been very close to this conversation with Cassie as well, and not necessarily just what we discovered here in South Africa going through that funnel model, but also when we shared our assumptions and thinking with Osama and the health practitioners out in the UAE, that we are nearing a target audience that are vulnerable. And in the recent discussion with especially Professor Jason Banki's, one of the assumptions that we thought was an accurate assumption was that universities as the primary agents for providing education to student groups would participate. That was very soon a no-show, simply because of the potential legal ramifications of providing incorrect advice to the students, and which might expose them legally. So again, if you look at the research data points, the use case is there. The students, and I'm just referring to students, it could be very much applied to any of the other segments that we have. We eventually switched from the target population groups to whom will be potential buyers. So the assumptions we're making here, as you can see on the business case assumptions, is that we believe that corporate South Africa, in many respects, would be a potential buyer for the service. In this model, we see that students, for instance, and assumptions we're making is that, and back to Willy's example of his experience recently with a telecommunications company, as a very minimum, folks that are connected by a mobile telephone, that have data loaded on that phone, that are connected on the internet to receive both the opportunity to dial into services such as what SADC is providing. And our ambition is also to modernize their infrastructure to provide a more robust online experience to their callers and the segments that the corporate customers will be interested in. And as we mentioned earlier, the assumption we're making is corporates have funds available for social responsibility impact initiatives. And that would be a prime target for us to go after those funds. And the Vodacom's, the reference case that I just mentioned this morning, the 131 billion rand of budget spent annually by the young youth of South Africa. That clearly is a vast population group that the corporates would be after, to get connectivity to them, to brand, whether it is a cell phone contract, whether it is a bank account, or just merely a social responsibility initiative to say, this is our attempt to support your needs in mental health care. So that is just, and I'm not going to read through all of those statements. These are some of the assumptions we're making as the corporate South Africa being the primary audience that we will approach in selling this offering to, whilst the student population, and for instance, or for that matter, all the other populations that we've got segmented as beneficiaries of this service, will get this as a zero-rated service.